Hey everybody, welcome back to the channel. Have you ever felt like you've got a hitchhiker on your road trip called lower back pain? If so, stay tuned. In this video, we're going to teach you how to kick that hitchhiker to the curb. Before we start, remember to smash that like button if your seat in your car has ever felt like a medieval torture device. Also, hit the subscribe button in order to follow us for more spine-friendly content. My name's Dr. Daniel Bridge, and I'm a chiropractor in Helena, Montana. Driving can be such a challenge for someone when they're dealing with lower back pain. I hear it from my patients all the time. They feel like, hey, I'm going on a road trip this weekend. I'm really worried about how it's going to affect my back. Or they just went on a road trip and they didn't do good and they were in pain the whole time. Our spine has a natural curve in it that we call a lumbar lordosis, and we want to support that. If your chair is old, if it's beat up, or maybe it just doesn't fit your body right, you're not going to be comfortable there. It's going to be easy to slouch down, and the first thing that you want to do is try to sit up as nice and straight as you can, and then bring your seat up to match that, so that your knees are at a relative 90 degrees with your hips and your lower back. A lot of vehicles these days have a button that you can fill up a little airbag to help support that. But they're kind of a one-size-fits-all. It may work for you, it may not. So what I'm recommending is you get a lumbar roll. They sell special lumbar pillows. They've got a million different types online. Find out what works for you. But even before you go and do that, everyone's got a towel at home. Roll it up and put that there in the small of your back and find a spot that feels good for you. You might want to move it around or, a little bit up or a little bit down as the drive goes on, just to find the spot that works good and to give certain muscles a break that haven't been getting a break. That's number one, is getting some good support. The next thing is, even if you're in really good posture, your back can get tired over time. So you want to move things around a little bit. You can bring your seat back a hair. You can maybe bring it a little bit forward. You can slide your chair forward. You can slide your chair back. That way your back's not going to be in the same spot the entire time getting tired. So find what works for you. But I would move it around every 15 minutes or every 30 minutes to find that best spot. And if you're anything like me, this last strategy is probably going to be the most difficult for you. And that's taking a break. Sitting in the same spot for 6, 8, 10 hours in one day can be very taxing on your back. So you're going to want to take a break every hour. You'll let all those cars pass you that you've worked so hard to pass, but just, it's okay. Pull off at an exit or a rest stop and get out of the car. Even if it's not a long break, even if you're just walking around the car or walking on the sidewalk for 2 minutes, 3 minutes, it can make a big difference. Okay, you've found a spot to take a break, you've walked around a little bit, now you want to do some stretching. My favorite stretch is putting your arms or your elbows against your car and relaxing your hips and bringing those forward just like so. Leaning your head back, looking up towards the sky, and then back down. And you'll hold it for 2 seconds. 1, 1,000, 2, 1,000, and back. That's a good stretch because it's going to target your lower back. If you're having any disc issues or sciatica issues, it's going to help with that as well. It's something that doesn't require you to get on your hands and knees when you're out in a dirty, field or whatever, and also you don't have to lay on your back. You can just stay on your feet and use the car as your support for that. Those are my 3 tips. Now, for those that have listened to this point, I'm going to reward you with 2 extra bonus tips. Like I said, depending on how old your seat is or how comfortable it fits your body, you might have a dip in the seat that can throw off the way you're sitting. Hopefully it's the same on both sides, not that you're really forced to lean in to one side. This strategy is for if you have too much of a dip, your butt where you're sitting is very uncomfortable, grab yourself just a nice small pillow and sit on it. It seems obvious, but it can make a big difference. Even just sitting here, I'm way more comfortable. You couple that with that support in your lower back, and you're going to be having way less pain, and you're going to be able to drive for a lot longer without feeling like you're undoing all of your progress. Now, the other scenario that I mentioned is maybe you have one dip. You know, some people, they sit like this, or they bring a leg up when they're driving, and you can wear a groove into one side or the other. That's where it gets a little more complicated. But what you can do is take some rags or some small towels and just layer by layer, put those on one side until you build that up, and then sit down and see, is that enough? Do I feel even? Do I need another rag? Put that down until you can feel that your hips are even. Because if you're sitting in a seat that somebody else has sat in and one hip is forced to go down, it's going to kill you. You're not going to last very long at all before you're feeling a lot of strain and a lot of tightness in your lower back. Thank you so much for watching. In the comments, please let us know which one of those strategies was most effective for you. Also, there's a lot of people out there that spend a lot of time on the road. I'm sure you've learned different tips and strategies that have been helpful for you. If that's the case, please let us know. Share the wealth. Lower back pain is something that is so debilitating. For people that are really dealing with intense problems that aren't going away on their own, see your local chiropractor or come see us here in Helena, Montana. We deal with a lot of lower back pain. A lot of our patients have sciatica, and as you've probably seen in some of our other videos, decompression therapy, laser therapy, shockwave therapy, those are things that can all be very effective in treating sciatica, bulging discs, herniated discs conservatively. You don't need to take time off of work, like 6 weeks off of work to not move around. You can still go about your life while you're healing your spine. Once again, please make sure to like this video and subscribe to our channel. We always really appreciate that, and share our content so that other people can live a pain-free life. Thanks a lot. We'll see you on the next one.